So looking at the next upper limb issue, this is what it sounds like: hip knee instability, or there's actually what a deformity coming up. All right. So for the hip knee instability or deformity, they are quite different conditions. All right. So we're going to talk about them like individually. You understand? So what this simply means is, we'll talk about the instability at the knee, then we'll also talk about what the instability at the hip. Of course, instability, from there we'll now move towards deformities that could occur. Of course, deformities occur hand in hand with what instabilities. You understand? So the hip and knee instability or deformity, right, a lot of things could cause it. You understand? We'll talk about the causes. You understand? So what could make your knee unstable? So many things, like what? Your ligament, okay? Anterior collateral ligament, medial collateral ligament, lateral collateral ligament, posterior collateral ligament. They are helping to keep the knee in order. If any one of them is tearing, you have issues, right? So sometimes it could be that the knee became inflamed, the knee joint became inflamed. Sometimes it's mechanical issues, or there's like direct injuries, to the knee. That's trauma. So symptoms is you find your knee giving way or buckling, there's pain, sweating, or clicking or locking, the person is having difficulties trying to stand on that knee or stand on that leg, right? So I have problems with bearing weight and have problems with walking. So treatment options is what? Rest and what? Physical therapies, bracings. Then sometimes if it is because of the ligament tears, you have to do some surgeries just to repair it. Then going to hip instability. All right. So hip instability, I actually switched the pictures. Is this one? So the head of this femur is supposed to be in one place. You understand? But if the head of the femur is not being in one place, you cannot make it. The femur is entering, is coming out, is going out. You understand? So you just have to do it. The movement of the ball and socket joint is too much. Many things can also cause it. It could be ligaments are loosed or tearing. It could be traumas. It could just be that the person was born like that, in a condition known as what? Congenital hip dysplasia. So who it affects? People with hip dysplasias, athletes that have actually used the hip joint too much, So impact, there's pain, the way you move that part of the body is reduced, and the way you flex that part of the body is reduced. So there's impaired quality of life, okay? So it can affect your day-to-day activities, can affect the athletes, If you're an athlete, affect how you are performing. Imagine Usain Bolt have this issue. He wouldn't have been the fastest man in life, So deformities, this one is just the valgus and varus. So valgus is what? Your knee joint is going inside, okay? Varus is what? Your knee joint is going outside. It's just simple like that, So risks can lead to worsening osteoarthritis, may also affect what? Your joint alignment. This is, valgus, right? But this picture explains it better, all right? So that's it, guys. Okay, bye for now.